From Rectangle Health, this is the Modern Practice Podcast. Every episode, we tackle a timely topic to help you stay current and simplify the business side of healthcare. Without further ado.
Hello, everybody, and welcome back to the Modern Practice Podcast presented by Rectangle Health. We've got a great episode today for any healthcare provider who is looking to improve their digital footprint, reach and attract new patients, and retain existing patients. I'm excited for this episode as we have the pleasure of hosting Paul Harris, Sales Director at Glacial Multimedia. Glacial Multimedia is a Rectangle Health partner and a digital media agency that works with healthcare practices, especially in the vision space, managing their website and marketing. Paul, welcome to the show.
Hey, Gary. Nice to have me. Thank you very much. Appreciate it.
Pleasure's all mine. And I want to start out, let's talk a little bit about you. As a longtime marketing and customer service professional, how did you get into helping practices expand their digital media efforts?
It's a great question. I just this week crossed my 6 years with the company, so I've been the sales director here at Glacial Multimedia. And
congratulations.
Thank you. Appreciate it. Boy, time flies. It's really crazy. I've had a long ride in marketing, right? And I've been in many different marketing verticals in the B2B space and the B2C space. And then I found this agency and settled in this kind of healthcare space. And what really excites me about this particular area of marketing is that a lot of practices do need help, and that's not a slight on the practices themselves, but it's easy in healthcare to think that all of your patients come through referrals. So one of the primary verticals that I serve in right now is ophthalmology and vision and eye care. And in that kind of space, we're really helping people and practices acquire new patient leads, get more cataracts, more LASIK surgery, and that's kind of the core of our business.
Awesome. And I envision it's changed dramatically in recent years. Providers used to rely almost entirely, as you mentioned, on referrals, word of mouth to attract new patients. And these days, having an online presence has become much more important, perhaps the most important way. Can you talk a little bit about how that shift in the landscape happened, and are providers' attitudes towards managing a website, posting to social media, responding to online reviews different than they were just, let's say, a few years ago?
Yeah, it has totally changed. The average person in the market in your healthcare, you do have a decision, right? And there's a lot of pre-education that happens, even at the referral base, right? So it used to be that, you get a cough and your primary care provider says, or, you need to get referred to Dr. White or Dr. Smith, right? Now they're Googling those people when they get home in the evenings, looking at their profiles online. Are they well reviewed? Do they have strong websites? What is their backgrounds? A lot of people are doing that. And then there used to be the old kind of, pushback that, for a lot of the older patients, they're not online, right? And they're not using the internet to go make healthcare decisions. The data just shows that in the current 2024 market, that's simply not true. They are tech savvy these days. I mean, they're checking out your Facebook page. They are using Instagram, and they understand the internet. So it's really, really important that you have a professional digital footprint. That's what we help with them do.
Yeah, absolutely. And having an entry point into that connectivity, this massive connection that we have through social, through the website, online. And I want to start with, let's talk about setting a practice up with a website. How does that initial conversation start? Do they typically reach out to you, or are they referred to you by other practices that you work with?
Well, as I said, our primary vertical has been in eye care. But I serve now many different verticals. Now we're doing a lot more in dentistry and dermatology and ENT and plastic surgery. So I would say that the majority of practices do come to us with a website at minimum, right? Typically it's neglected, and they're very even aware of it at this point, right? They have like old HTML website, or it's just simply like easily a decade old. And you can just see that based on the stock photography, the usability. Maybe it's not responsive. So we just bring them up to the speed typically. And what that really means for us is like, what's your mobile performance look like? Does it look professional? Are you proud of it? Is it compliant with the American Disabilities Act? Does it have HIPAA compliancy? These kinds of things that, used to be a good to have are now a legal must have. So I know we bring them up to speed and get them a beautiful website as step one. step two, okay, you build your home. How do you get people in your home, right? And that's where we come in with some marketing services in the back end.
Yeah. And do you feel like these providers are often overwhelmed just looking at, let's say, a dated website or even one that they come to you and are super proud of? Say, I'm really confident. I want to get another set of eyes on it. Do you feel like when you make these recommendations to be legally compliant, to cater to mobile, to cater to every single rule and regulation there is out there, do you feel like there's a sense of overwhelmingness in tackling something like revamping a website?
I wouldn't use the language overwhelmed. I would just say that there's an education gap, and a lot of doctors just simply don't know what they don't know, right? These physicians are so skilled, but they're skilled at being physicians, and that's what they should be, right?
Absolutely.
They come out of years and years and years of medical school, but what they lack oftentimes, and it's certainly not a slight, is they don't really get that marketing or sales experience or even the business experiment in the acronym to be like, okay, out of all the day things that I have to do, maybe I need to set aside, that 15, that 20 minutes a week to focus on my online presence and how I'm marketing myself. So, it's not necessarily a fear or overwhelm. It's just, they need professional help so they can just get peace of mind. Say, like, not my world, that's your world. I'm going to outsource it and pay for you guys to do that.
And when you look at a website, and is the mentality, have you found that the mentality is, okay, I've got this great website, I'm launching it tomorrow. Is the perception that once you launch it, if you build it, they will come? Or are they thinking, I need marketing, I need traffic to the site? Or are you sort of, navigating that conversation?
Yeah, it depends, right? On you build it, you come. Like some practices have been open and thriving and successful for 30, 40, 50 plus years because they are 100% referral, which is fine. If you're like a retina doctor, for instance, if you don't get referred to that type of surgery unless you have a serious medical problem. So those types of doctors, a little less interested in their website because they know people are going to be coming to them, regardless of what the website looks like, they have a medical problem. So, but it's when we get into that elective space, that's when the doctors get it, right? If I'm making a cash out-of-pocket elective decision to get a LASIK eye surgery or to buy a premium lens or to do, an oculoplastic facet surgery, a Botox, a cosmetic dental, those physicians get it because that user is making a buyer's choice. And they know that this procedure is going to cost them potentially thousands of dollars, and they need to present themselves as the best viable option in their city or area.
That makes sense. And I want to get into, what does that look like? What does that website look like? Some of the common mistakes that practices make when they attempt to set one up. What is the ideal, in your eyes, healthcare practice website look like?
Oh, wow. The ideal. Well, beauty is in the eye of the beholder, right? So aesthetically, I definitely know what's pleasing, but I'm not one to say that. So, but it does have to hit a couple minimum standards, right? It has to have a strong SEO presence, right? I look at that from a technical standpoint, and I could get into minutia, but briefly, I look at things like site speed. How long does it take the website to load? Or how great is your experience on the desktop versus an iPad versus a mobile phone? Those things are really important. Next, I mentioned it, compliancy. Is it ADA compliant? You could tell that very quickly. Is it HIPAA compliant? What are your forms and all your calls to actions look like? Do you have a schedule an appointment now or take a self-test? Where are all your phone numbers and are all those accurate and correct? And then off page of the website, there's a lot of things you can do to audit the practice too, like how well are you reviewed, right? You can look at the Google profiles. Do you have professional images inside and outside of your office space? So all of those things are kind of the bare minimum things that you can kind of audit and look at. Another thing you can also look at is the doctor profiles themselves, right? So you have, every practice has a location profile for the business and then a physician profile. And oftentimes for heavy referral practices, they never ever Googling the practice's name, but Googling, I was referred to Dr. Paul Harris, and then that profile comes up first. So it's all about making that first impression.
You touched on this a little bit, and you mentioned a number of verticals that you serve. I want to just get into it a little bit deeper. What's your approach to making a great website for an optometrist versus a great dental website?
Thinking about the audience is very, very important. But I would say that I always tell practices is that you want, no matter what we're looking at in the medical site, first of all, the average patient, you have to think like the average Joe, right? So in the world of optometry or ophthalmology, you have to think like the average person on the street doesn't know anything really about eye care. And let's be honest, they probably can even hardly spell the word ophthalmology correctly, right? It's a tough one. And
it certainly is.
So what are they thinking about? Obviously, they want some education about the surgery, but they don't want to get bombarded, first of all, with medical jargon. Right. So we don't want to hear about your femtosecond laser. Like that doesn't mean anything to the average Joe on the street. So whether I'm working on a dental website, an ENT website, an eye care website, a plastic surgeon, hit the core 3 patient fears. And what are they, Gary? How much does this procedure cost? And now I know most practices won't particularly say like their cost out, right? But you could say like, we accept XYZ insurances. You can use your HSA. We have, financing options. So something about that. Number 2, is the procedure safe, right? Talk about its safety and how you'll, how the treatment works and what to expect both post and pre-treatment. And then finally is a little bit more about how long is the recovery time, right? Because I don't live in your world. I don't know anything about your world, but I do know I want to golf on Saturday, or I have that wedding coming up, or, I want my smile to be perfect for that particular event I've got coming up, in the dental world. So if you can usually hit those 3 patient fears, my goal, I always say, is to put the butts in the seat. What I mean by that is the marketing should just book the consultation. And once you're in the room with the doctor is going to give you that higher level education at the medical level, right? But as marketers, I just want to present them as an opportunity to book that consult.
Makes sense. And as you were listing those top 3 must-haves, I'm just thinking literally everything you mentioned, from the pricing to the recovery time to the procedure itself and what's involved and what's accepted as far as the insurance and how you pay for that care.
Yeah.
As you're speaking, I'm just thinking, I'm picturing myself Googling a service, right. And these are those 3 things very much so I could see myself typing out and trying to gain some education on to pick a provider. So I can imagine that helps greatly by filling that website up with that valuable resource and that content.
Yeah.
It must help your searchability, right?
Absolutely. You want to think about the way that people search, and they typically are asking Google questions. So an example is LASIK safe? ? Right? And a great way to optimize your website for that is literally have a title, is LASIK safe? And then write a paragraph of content answering that particular question. How long is recovery? There are many, many examples, but you start to do this keyword research and you realize that there's a way to kind of build out. Oftentimes we'll do frequent asked questions sections where you can kind of optimize for those key terms that people are Googling that are relevant to your services.
Yeah, it's amazing. There's so much to think about, and it seems simple at its core, but just thinking about everything we've just discussed in these past few minutes alone, there's a lot that goes into a site.
Yeah.
Well, I want to shift gears here a little bit and talk about your partnership with Rectangle Health.
Yeah.
How does it work? Once you're working with a client and helping them set up a new website, how does Rectangle Health's practice management bridge platform fit in or come into that equation, and why is it important?
Well, we've been partners with Rectangle, I believe, for about 3 or 4 years now. And we have many partnerships that want to partner with us because maybe they sell a medical piece of equipment that might be relevant, or maybe they're another software or CRM or whatever. But the reason why we think Rectangle is such a fit is that And your website should be a vehicle, as we've discussed, for marketing, right?
Yep.
It also should be a function of your business tools. So what does that mean? Like, absolutely, I want whatever your patient portal is, I want it there. And when it comes to specifically bill online options or like pay my bill buttons, like that's where we first started this relationship with Rectangle, because that's something that we didn't provide. That's not our core expertise. So I know that you guys have grown greatly, just more than just like online bill pay, but that's really kind of how I open the door to my clients and my presentations. I say, okay, do you want online bill pay, right? And oftentimes they'll say, I hadn't considered that, and we're still sending out paper invoices. And if I hear that, I'm like, okay, well, like, do you want to collect faster? Do you want it to be easier on your team? Do you want less phone calls?
Save money.
I've got a great resource for you, and that's typically how I've been working with Rectangle. I kind of pass them the ball, and I say, they have a deeper scope of services. I know you have many integrations with practice management systems and EHRs, but it's easy gateway for me to open the door and say, okay, you should talk to them. And whatever scope of services that we can get them on, we add a link on the website we build, and they're good to go.
It's amazing how it comes full circle from the point of capturing a new potential prospective patient, nurturing them through their care journey cycle, educating them, telling them what they need to know about recovery, cost, all of the above, and then to the point of getting the treatment, paying for the treatment. And as you mentioned, beyond that, Rectangle Health has grown exponentially,
of course,
from reminders and compliance tools, all of the above.
Yeah,
it's all baked into our practice management solution. So last question before we wrap up here, Paul, and I want to bring things full circle. We've seen healthcare providers' attitudes change rapidly in recent years about the value of online presence.
Yep.
How do you see it changing, let's say, in the next 5 years and 10 years? Is there any emerging technology that you see them embracing or avoiding? And I guess this was a 3-part question. Do you think that even the providers who are most reluctant to expand digital efforts will eventually have to if they want to thrive and grow?
Absolutely. Many components on that question. Sure. And as I think about it, a couple things I think we know are true. If you do not have any online presence, you are already years behind your competitor. Like that is just simply true. And I see a growth of even the older physicians who have outright owned their practices for years and years and years and completely neglected it. They even understand it because they come up to me, and you can hear that, hey, I need a new website. Please don't even look at the one I have right now. Like, you can hear almost the embarrassment in them, so it's indicative of them understanding that they neglected an important part of their business. And moving forward, what we kind of see is the trends in healthcare. A lot of it has to do with this emerging abilities and capabilities of AI, really, and that is just being tapped into as far as what we do in the medical marketing side. But some examples are like a lot of practices have gotten great value out of doing an ongoing blog, right? But they've never really had that time. So now I'm starting to see practices like explore, okay, well, like maybe we have AI help us and assist in the blog. And there are a lot of debates internally between my team about is it AI good or is AI bad SEO? But my general attitude is that everything's worth a try. You know what I mean? If you're not doing it now and it's a very little lift, let's give it a swing, right? Because we can ultimately A/B and test this and see okay, what pages are getting the most traffic. So, the AI is one of those things that I see as emerging technologies. The other thing I would highlight is the growth of importance in the Google My Business profile has been really, really critical. I almost feel like Google's algorithms might make the profile itself just as important as the website. Because if they get to the point where they add a call to action button within the Google profile, like let's say it says contact us and you can fill it out without ever entering the environment of the website, then you essentially have that as your microsite. I've seen small practices on very, very tight budgets really kind of do nothing but manage the Google profile. And that has driven traffic to them, because I think that when you look at that like local aspect, particularly for a practice that's in maybe has a couple locations or one location in an area, like you really need to think about where you're ranking and how that's presenting itself. It really is critical.
Yeah, it's expanded. Just to Google My Business Profile is another point of capture, right? Another point of education, another point of a potential phone call or a conversation that could lead to a lifetime patient.
For sure.
I love that. Thank you so much, Paul. Yep. How can our audience get in contact with you? Any site, LinkedIn?
Yeah.
What would you?
Yeah, sure. You could follow me on LinkedIn, of course, very easily. Paul Harris, Glacial Multimedia should be available there. Excuse me. You can find me glacial.com. And if you're interested in a free website audit, we do that all the time. We never charge a dime for them. You can type in your website. We can assess that, let you know what we potentially see and how you can improve. And, know that like many agencies, we're a one size does not fit all approach, right? If you just need help with some edits, great. If you want some help managing your social media, great. If you want a full-blown brand new website, great. But, our ultimate goal is to show value. And one of the ways we do that is making sure that we do the right things for the customer and give them a fair price. And also customer management has been a huge focus this year too. And in our particular industry, we see a lot of lackluster response time when it comes to simple client requests and edits. And it's something that is a huge part of our ethos that, when you call us, we answer the phone.
That's awesome. I will have links to your LinkedIn profile, the website, all of this episode description below. And before we wrap up, Paul, thank you so much for taking the time to join me today. This was super valuable. I think our audience is going to get a ton of value out of it. I highly encourage you all to connect with Paul on LinkedIn and just have a conversation. Start the conversation, see how you can expand and grow your business. Once again, Paul, thank you so much for joining me.
Hey, I really appreciate it. And as I said, we can't say enough about a partnership with Rectangle Health. We like to think you guys as local, being in Boston and we're in Maine. And so it's also, it means a lot to us to kind of work with a partner that's kind of down the road.
Appreciate it very much. And we value the partnership equally.
For sure.
For our audience tuning in today, if you enjoyed this episode, hit that like and subscribe button on your favorite streaming channel. And be sure to stay tuned as we got more great episodes on the Modern Practice Podcast coming soon. Thanks for tuning in. Till next time, everybody.
Thank you for listening to the Modern Practice Podcast. If you enjoyed today's conversation, subscribe on Apple Podcasts, Google Play, Spotify, or SoundCloud for new episodes. And follow Rectangle Health on social media for more helpful information, news, and event details. Thanks for tuning in.